Are you struggling with hair loss and tired of wasting money on products that don't deliver? In this video about hair loss treatments, the supplements that actually work, and why popular options like Biotin might not be the miracle you've been told. If you're ready to stop the guessing game and start seeing real results, keep watching. If we haven't met yet, my name is Beth, and I'm a 60-year-old physician assistant practicing dermatology for 24 years now. I'm here to bring you the treatments and supplements that work from both Western medicine and Eastern medicine to give you the best of both worlds. First on the list, we have oral minoxidil. Now, minoxidil is approved by the FDA in topical form to regrow hair, but orally they were using it as a blood pressure pill, and the people noticed that their hair was growing. So it is very effective as a hair growth pill, but technically they say that 2 out of 3 people will notice a benefit. I have seen a lot of my patients really get a lot of hair growth from minoxidil. It is basically, I say it's like fertilizer for the hair, but it increases blood flow, and that's how it increases hair growth. Now, it does grow hair everywhere, so men are usually more okay with that than women. In fact, most women would rather not grow hair in other places on their body and just try to get it on their head. Guys don't care as much. You can have temporary shedding of hair when you first start to take it, but that stops in 4 weeks. There was a large study on oral minoxidil, and 2.5% of the patients stopped because of side effects. That is a very low percentage, but still, if you have a higher dose that you're taking, the higher doses can cause ankle swelling, low blood pressure, worsening hangovers, which is a weird one, and headaches. We give very small doses for hair growth, and you avoid those other side effects when you just have the very low dose. Now, all of the medications are not going to work for every single person, and some people may have side effects with some of them, whereas others won't. And you may want to do more than one thing in order to get the best hair growth. Our next treatment is topical minoxidil, and it is one of the few that is actually FDA approved to grow hair, and they had to do the studies to get that approval. It can cause scalp irritation, however. There's 2 strengths, 2% and 5%, and typically the women's was originally 2%, the men's was 5%, because men have thicker scalps, are not as easily irritated as the women. So then, since then, they have come up with the 5% for women because it does work better. But if you get irritated, you get some eczema, you get tangled hair or breakage from this, then you may not be excited to use it. Some people do lack the enzyme in their hair follicles to activate the medicine. So you have to take that into consideration if it's not working for you. I have some here, and this is a generic minoxidil 5% foam. So it comes in a liquid and a foam. Scalp massage and various oils. Now, scalp massage, like with this device or just with your fingers, will help increase blood flow to the scalp. There was a large study in 2016 where almost 50% hair regrowth was noticed, but that was after they had massaged their scalps for 152 hours. So that is a very long time to be massaging your scalp. But as a regular practice, that will help to improve the circulation to your scalp. And anything that improves the circulation to the scalp is going to help the hair regrow. Now, there's various oils out there, and some of the oils will be improving the condition of the scalp as far as making it healthier, but may not increase the circulation per se. Now, rosemary may help prevent graying, and it's been known to stimulate hair follicles so the hair will grow longer and stronger. But you guys will want to avoid the beard area because it does block something called dihydrotestosterone, which for women that'd be okay, but for guys we do not want to block that because that will keep your hair from growing in the beard area. The next oil to talk about is burdock root oil. Now that does boost the circulation in your scalp and removes scalp irritation. It delivers fatty acids to the roots of the hair, so that's something to consider. Cinnamon oil, the cinnamaldehyde in the cinnamon oil, has been shown to increase hair growth in rats, causing longer hair growth and increasing the blood flow to the hair growing area, let's say. So there may be other oils that people will talk about as helping with hair growth, and something like lavender will help reduce stress, and they say that could help with hair growth. But these are the ones that I did find some evidence that these actually would help with hair growth. Now, stay tuned. We're going to go over a lot more to come, and we're just getting started. Now to talk about our most expensive option on this list. This is called Scalp PRP, and it stands for platelet-rich plasma. It is considered safe and effective, but results do vary from person to person. It does use platelets from your own blood to stimulate hair growth, and it's injected into the scalp. So they take your blood, spin it down, gather certain factors into the syringe, and then inject it into your scalp in multiple injections. The review of 12 clinical trials stated that it improved hair density and thickness in 84% of the studies. It may require multiple sessions, and it is contraindicated if you have any blood disorders or any infections on your scalp or in your blood. Next up, we have a supplement that you can order either on Amazon or on the website that has 20 studies, at least 20 studies, showing a greater than 80% success rate. It's called Nutrafol. And I like that they have a formulation for just for men. They have a formulation for women who are premenopausal, and they have a formulation for postmenopausal women called Women's Balance. So I like that they tailor it to different groups of people. It can cause GI discomfort. Of course, you could have allergic reaction to one of the herbs that are in it. There could be interactions with other medications you're taking, but I have seen quite a good success rate with Nutrafol, and I have taken it myself, and I have noticed a whole ring of hair in the back that started to grow, and then I did notice more hair growth on top of my head. And after 6 months, because hair does go in a 3-month cycle, so you're going to want to do anything you do for hair growth for at least 3 to 6 months. And so after the first thing I noticed was that I wasn't getting as much hair shedding in the shower. I used to get quite a bit. I felt like it was a whole wad of hair coming out in the shower, and then it was just a few strands. And that was just after a few months of starting the Nutrafol. I have had good results with that personally and with patients. This is Nutrafol either for men, women, or Women's Balance. The sixth thing on our list is a prescription called Spironolactone. It's a pill, and it does decrease the production of androgens, and that's how it helps hair regrow. I don't prescribe it to men because of that reason, and it can cause gynecomastia in men. If you don't know what that is, you'll have to look it up. For women, we need to have a higher dose, typically 150 milligrams of spironolactone to help with the hair regrowth. But at lower doses, you can use it for acne, and it also reduces oiliness. So for women, it can be a very good option. It does help you hold on to your potassium, however, because it is a diuretic, so it does help get the extra water off, but it does hold on to potassium, so you don't want to be taking extra potassium when you're taking this pill, such as in a salt substitute. This is a prescription, and so is the oral minoxidil is a prescription. There are plenty of things on our list that are not prescriptions. Number 7 on our list is something called low-level light therapy. Typically it's red. So you may see these advertised on television or on the internet as a red light therapy inside a cap or a helmet. It looks like a football helmet or a bicycle helmet or just a regular ball cap that has these red lights inside. Results vary from person to person, but it can be considered effective. It does stimulate activity in the hair follicles and increases blood flow, which extends the growth phase of hair. Consistency is key, and you need to use it over several months to see results. It may not be suitable for everyone. In fact, I know someone that got a headache from using the red light therapy cap, and so he had to stop it. Studies show that you get a 39 to 40% increase in the hair growth. Of course, you'll have better results if you do combination therapy. Do this along with taking some oral medication or supplement, that sort of thing. So we've got red light therapy, and the price will vary as well as the effectiveness from person to person. Next on our list is something from Ayurvedic medicine, which originated in India. So that's Bhringraj is a plant known as the king of hair, and it promotes hair growth and strengthens hair. It may reverse graying too. And these are some of the other things that this little magical plant might do. It may decrease cognitive decline. It can help with relaxation and sleep. It may be a liver detox. It may help with skin issues. It may act as a diuretic or water pill. And it does come in a powder, pill, and oil. This is the oil that I did order on Amazon. And you can use the oil, or you can mix the powder. You could mix the powder with coconut oil to make it into an oil. And so you would massage that into the scalp for 30 seconds and then let sit for 30 minutes and then shampoo it out. You can also order the Bhringraj supplement and take it orally once a day. I would take it in the evening since it can help relax you and help with sleep. Ninth on our list, we turn to the ancient practice of traditional Chinese medicine for a plant called the nettle leaf or shunma. Now, it is a perennial flowering plant, and it comes in a tea, an extract, supplements, powder, and capsules. So this is an ancient secret that they have used for growing hair for centuries. And by the way, this video is sponsored by me. I'm going to put a link to a free list of products that I'm currently using down in below the video. So if you are interested in that, check it out. Also, I would love it if you would consider subscribing to the channel. It really helps my videos spread to other people. Now back to the rest of our list. And at the end, I will tell you the real deal about biotin supplements. Number 10 on our list is something called plum blossom needle acupuncture. This is also a traditional Chinese medicine technique to help with hair loss. Needles are inserted in a special plum blossom pattern, which an experienced acupuncturist can do. This will help adjust hormone levels. Now, speaking of hormones, let me take a second to say that hormone replacement therapy can help with androgenic alopecia, which is the hereditary hormonal kind of hair loss that we're talking about helping today. But if you are, especially if you're in menopause, the hormone replacement can help. But if you're taking extra testosterone, which is often given along with the estrogen, that will counteract the hair growth, and you will probably want to do some of these other techniques and supplements and prescriptions that are on this list. For number 11, we have something called a Dermaroller or a stamp or a microneedling. Those are devices you can order like on Amazon, and you can use it to make tiny punctures to stimulate the hair follicles and cause increased hair growth. It can be used with topical minoxidil, and by improving absorption, it helps it get in there better. You want to make sure and clean the roller real well with some alcohol. And the microneedling often has different tips that you put on it, so you're not reusing the same tip. Potential side effects include mild redness, swelling, and discomfort, but those usually subside quickly. This is number 11. Stay tuned for the last one, plus the biotin story. Number 12 on our list is Finasteride or Dutasteride, and those are prescription medications. The Finasteride has been used for years for male pattern baldness or androgenic alopecia for men. They just didn't want women taking it who could get pregnant. So it has been approved for the male pattern baldness, and they have given a 1 milligram pill to them for many years. Now, Dutasteride is approved to shrink the size of the prostate, and Finasteride will do that too in a higher dose, but Dutasteride is stronger at decreasing DHT levels in the blood. The Dutasteride decreased the DHT by over 90%, whereas Finasteride decreased it by 70%. Dutasteride also has a longer half-life of about 5 weeks compared to Finasteride, which is only about 5 to 8 hours. Typically, Dutasteride, you only need 0.5 milligrams, and Finasteride for men has been 1 milligram. And I typically will prescribe a higher dose for the women on the Finasteride to see better results. But this would be something you have to talk to your healthcare provider about taking. So this would be an off-label indication for the Dutasteride or the Finasteride at a higher dose. It doesn't prevent building muscle or strength when you're taking testosterone. I thought that was an important key thing to note. And you do want to take it for 6 to 12 months in order to see if it's really helping. And the sexual side effects are basically the side effects that are listed. They are rare. They can include things like decreased libido, erectile dysfunction, breast enlargement, or tenderness, but those usually reverse when the medication is stopped. However, you will hear stories about people having some sort of side effect with it. So as anything, you can react badly to anything at any time. So you definitely want to talk to your healthcare provider about these medications, but they do work extremely well for the hereditary hormonal kind of hair loss, which is the androgenic alopecia. Okay, here is the truth about biotin supplementation. Unless you have a biotin deficiency, and you would have side effects that you would probably notice, unless you have the biotin deficiency, you will not benefit from taking extra biotin. It will not help your hair grow. There's so many things that say, yeah, take it, it's great, it's in all these extra vitamin supplements, but unless you have a deficiency, it's not going to help hair grow back. I hope you've gleaned some value from these 12 treatment options, and hopefully you can utilize one or more of them to help see some hair regrowth. Until next time, I hope you catch one of my other videos, and I'll see you in the next one.